I'd like to introduce Amit Gosalia. He is an audiologist born in New York, raised in Arizona, was a successful audiologist in the Washington State area and sold his practice to live the American dream in Southern California. He is a practitioner now in Southern California, really committed to audiology and improving the lives of his patients and their families. Active in volunteering, belongs now on the American Board of Audiology, of Board of Governors, American Academy of Subcommittee, and Amit has been a tremendous asset to this effort. We've been working with him for about a year now. I think this is really important to get folks like Amit and others that are presenting today to really step up and provide some of the leadership and get some of the information and their experiences shared with the larger hearing health community population. So without further ado, I'd like to welcome Amit to the first presentation today. Thank you.
I don't have the ominous presence as David, so I'm not going to use the mic so you don't have that echo, but I'll try to be as impactful if I can. So David, thank you. Thank you, Cognitive, for inviting me to speak. And thank you, Richard. Thank you so much for hosting us. It's a beautiful facility. Today, I want to talk to you guys about where we are as a profession and what we should be doing and what we could be doing. Because the reality is that we have been hit with storms after storm after storm since the beginning of our profession of audiology after World War II. And what are we doing about it? What do we do about it? Well, today I want to talk to you guys about cows. How many cows are in this room? Oh, good, good. Nobody raised their hand. In the Midwest, in the plains, when a storm approaches, what do the cows do? They turn and they run away from the storm. They turn and they run away from the storm, delaying the inevitable storm that's going to hit them. What do we do as audiologists when we get faced with a threat? We turn and we run. And we go on Facebook and we post and we bitch and moan about, oh, here comes another storm. I know I see a lot of smiling faces because you know exactly what I'm talking about. I want to impress upon you that I don't want us to be cows, unless you want to be a cow. I don't want you to be a cow. Are you getting triggered right now? Blood pressure rising? Heartbeat starting to race a little bit? Oh, I mean, I was going to have a good day today, and then you pulled up Costco. Oh, IHS. Oh, government regulations. Darn those hearing aid manufacturers for going into Costco and retailing hearing aids for less than my cost of goods. Darn that dispenser down the street who used the word tinnitus on their website. Competition sent a direct mail to our database, and a couple patients brought it in. Oh my gosh. And who else wants more government control over our profession? Are they doing anything illegal? Are they doing anything illegal? I can't hear you. No. They're opportunists, correct? They saw that there's an avenue for them to maybe take care of more patients, okay? Or they found a business model that works legally. So are they doing anything wrong? I don't think so. Lively. Does that hurt anybody's feelings? People love Lively these days. The idea is that they're not doing anything illegal. So should we blame them? Are they the problem? Are they the problem? Or is it you? And I'm with you, okay? And is it you at home? Okay, I'm pointing at the camera there for everyone watching live. It's you. No, it's all of us. Now, I don't say this to hurt your feelings and my own feelings, but a very famous audiologist who I love and respect once said at a meeting, the problem with audiology is audiologists. We continuously shoot ourselves in the foot with every threat that comes our way. We take 2 steps forward, we take 3 steps back. Now, when he said this, he wasn't saying it because he hates us. He actually says it because he loves audiology. He's one of the biggest pro-audiology people in our profession. And I wasn't going to call him out on it, but then I talked to him yesterday, and he said, please do. So Doug, is that a correct statement?
Yeah, actually that happened at the Florida Academy of Audiology.
Yeah. And just for fun, we'll just say today's the anniversary.
Yeah.
Yes. Perfect. The problem with audiology is audiology. Do you guys believe this statement? I live in Western LA. We don't call it Western LA, sorry, West LA, because we're hip. West LA. I have to drive up the 405 to the 101 to get to my clinic every day. Yes, we say the 405, the 101. If you went to the Ohio State, you know what I'm talking about. It's important to add the in front of the freeways. Why am I bringing this up? I bring this up because I live very close to the 405. And if I have to go to Home Depot or a grocery store, I got to go on the 405. How many of you have seen this picture? Yeah, that Variety building is like 2 miles south of where I live. Do you think that I'm going to be in the middle of that traffic jam, wasting my time contemplating all of my life's decisions? Or am I going to find another pathway, another opportunity? Something has impeded our progress. A storm has approached. Are we going to sit in that traffic jam? Let's talk about opportunities. So I want to go over 4 opportunities, excuse me. There are many opportunities for us to achieve success. So the first one, where are we right now? The signs at the back, if you weren't sure. American Institute of Balance, the world-renowned American Institute of Balance, with arguably one of the most famous audiologists in the world, Dr. Richard Gans. How many people here are doing vestibular in their clinics right now? Raise your hand. 1, 2, maybe 3, maybe 4. Take a look around, guys. That's 4 people out of how many people are in this room? We are doctors of hearing and balance. So what's the excuse? Oh, equipment costs too much. Oh, the reimbursement sucks. Oh, I slept through my vestibular course in school. I guarantee, and he's right here, folks. He's gonna be here all day. Talk to Richard. In 15 minutes, he'll prove to you that doing vestibular, being part of the Centers for Specialty Care, can not only be profitable, but you end up taking care of so many more patients. And something you're going to hear a lot of is interdisciplinary practices, working with other doctors and providers, providing balanced care. So talk to him today. We have a break and lunch. He's here all day. What about tinnitus? Anybody doing tinnitus in the clinics? Or are you just using it as a catchphrase in your ads? No, I'm teasing. Of course, many of us have taken the courses. It's a weekend course. Couple $100, maybe $1,000. It's nothing, right? Progressive tinnitus management, as Dr. Beck mentioned last night. Henry up in Portland and Tarzog. I want to quote names too, like Doug, because he's so smart and throws these names out. The idea is that tinnitus is humongous. It's the #1 service-connected disability at the VA every single year. Who are the providers for tinnitus? If somebody has tinnitus, who do they go see? The ear candling folks? No. They should be seeing us, audiologists. When the founder of Texas Roadhouse committed suicide, reportedly because of his tinnitus a few months ago, what did we do about it? Did we go out and tell everybody, hey, tinnitus is a debilitating issue, get tested, there's help? I got invited to speak on Fox LA, and Fox LA is one of the largest local news channels in the country, largest audiences. And I got on there and I talked about tinnitus and that there's help. We know there's no cure, right? But there's help. We can test it, we can find solutions. Over 90, I'll make up a fake number, 99%, okay? 99.9% of my patients that come in for tinnitus help leave with help and relief, right? Almost every single patient. after I did that video with Fox LA, the number of messages I received from the public was mind blowing. That most of these people are like, oh, I heard that I just have to deal with it, right? We need to change that bullshit recommendation that these people are getting from any medical provider. Just deal with it. Oh, everyone has it. Oh, it's normal. It's not normal. Everyone doesn't have it. We as doctors need to diagnose and then treat. Where did you hear that? Doug Beck, 2021. That's from last night. What about APD? We've been hearing about APD a little bit more lately. It's because of the Thunder Down Under, the Aussie herself, Dr. Angela Alexander. She's been promoting APD a lot lately. I'm kidding. She's a good friend of mine, so I'm making fun of her a little bit. But first time I met her, I was expecting this nice Kiwi accent. She's from Kansas. APD is another avenue, right? So there's opportunities in our profession as audiologists. We can't just let these obstacles and these storms get in our way. Well, there's a fundamental baseline here, and it has to do with cognitive health. And that's why we're here, of course, this weekend. You heard this last night. Uh-oh, there we go. What is the #1 risk factor for Alzheimer's? Wrong. It's age. I wanted to see if you guys were really listening. Dementia is different. It's not different, it's related. Alzheimer's is actually age. Of course, I'm playing around with you guys a little bit. Keck School of Medicine, they support a lot of the continuing medical CMEs that I do for physicians. And so I borrowed this from them. You guys saw this last night on a slide in a different format. USC out on the best coast, and you did hear that correctly, the best coast is the University of Southern California. What do you see up here? 40% of dementia cases can be prevented by addressing these lifestyle factors. Do you see something that pops out at you? That's right, hearing loss. What do we do as a profession again? Hearing and balance. When you guys heard this, because I'm not telling you something you didn't know, you've seen the articles and the research and the posts. Hearing loss is the #1 modifiable risk factor for dementia. Did you go out and buy every billboard on the streets to tell the public? Probably not. Did we get on the news channels, newspaper ads, social media posts? Did you even send a letter to your patients that, hey, come in and get your hearing tested and get a cognitive screening done? How many people here are using CogniView right now? Okay. They've developed a tool, and it's so easy to use, and it takes like an hour and a half, or no, it takes 7 minutes, 8 minutes to do. And it's so easy to use. Now, I'm not here to advertise CogniView. I know we're here because of them, and I appreciate it. But just yesterday, we got the email that CogniView's test retest reliability is it's excellent. They use a different word, but it's excellent. So we know that the screening tool is a good option for our patients. So if you're not doing cognitive screenings, and we're not utilizing speech and noise testing and testing all aspects of our hearing and balance systems, are we really providing within our scope of practice fully? There are 2 things I want to quickly bring up. Recently, you guys heard that there was a drug for Alzheimer's, and it's controversial. But there's actually a video game out again on the Best Coast, and that's not up for debate, the Best Coast. Out on the Best Coast, UCSF developed a virtual reality game, and it's called Labyrinth VR. Paradigm, I don't know. Labyrinth VR is the name of the video game. And what they did is they take patients who have cognitive decline, and they put these VR goggles on, and they go through this maze or whatever. I haven't done it. And after a certain amount of time, those patients that are doing this game start responding as well as 20 or 29-year-olds. It's unbelievable. And then Dr. Jill Davis over here, can you stand up, Jill? Stand up, they can't see you in the back. See, so Dr. Jill Davis, I'm just here to embarrass her. Dr. Jill Davis started a program where they're working with music training with folks that have cognitive decline. She's been doing this for how many years? Over 3 years. The studies have shown that if you have done any kind of music training throughout your life, the outcomes are so much better. When we create pathways, we also know that your brain doesn't stop creating new pathways. Your brain continues to make new pathways through your 90s. You're writing with your right hand over here right now. Use your left hand. You'll create a new pathway. Thank you. That part was sponsored by the Left Hand Association of America. The idea is that every time we do something out of routine, we create new pathways. We talk about this with our hearing aid patients. It takes 2 weeks to get used to hearing. How many times do we say that a day? I know I use it all the time, 2 to 3 weeks. Yeah, your voice will sound funny for 2 to 3 weeks. We create new pathways. We're working on cognitive decline. Early intervention is key. Don't wait until your patients are 85, 90, 100 years old to say, hey, maybe we should check if you have cognitive decline. And the semantics of what I just said are probably not accurate. Well, let's do a screening to find out if there's any concerns, right? So don't wait, early intervention is key. We've started using it with our younger patients, and I spotted a 55-year-old attorney who during his hearing aid fitting, and he was sitting here like trying to figure out how to put it in his ear. I was like, we better do a screening. And sure enough, on the old report, all reds, for those of you that are familiar with the Cognitive View report. And I thought, oh, that's very interesting. Sure enough, I said, of course, as an audiologist, I said, listen, I have some, there's some concerns on this report. I'm not here to diagnose because that's not what I'm going to do. I want you to see your primary care doctor. They actually sent him to neurology. He got a scan, scarring all over his brain. Obviously, he has something going on. And sure enough, they're now helping him. So in the fields, we have cows that turn and run from the storm. Buffaloes run headfirst into the storm. They don't wait for the storm to come and go bitch and moan online about it. Buffaloes go headfirst. Let's be buffaloes.